Hello, everyone, and welcome to the second webinar of the 2021 Florence Cellar conference series. And today we'll be focused on looking forward in terms of policy that affects the lives of older Ohioans from the state and federal perspective. Can you go to the next slide, please? I'm Diana Morse, and I am the director of the University Center on Aging. I want to welcome all you on behalf of the Center on Aging and the Francis Payne Bolton School of Nursing and Case Western Reserve University. These are our disclosures regarding conflict of interest, contact hours, and the CEs that we are representing today. We'll have a link at the end of the presentations that will take you to the evaluations and CE information. Next slide, please. We are going to start our discussion today looking at policy in terms of the recent state budget, which those of you in Ohio have known, many of your colleagues have been advocating for, and we're part of the process to produce the most recent budget. And we are fortunate today to have Beth Kowalczyk with us, who's the Chief Policy Officer for Ohio's Area Agencies on Aging. She works with the Agency on Aging and has a voice at the state to make sure older adults have a voice at the State House and with members of Congress and with state and federal agencies through legislative and regulatory processes. She serves on the board of Health Plan Foundation of Ohio and the Ohio Coalition for Adult Protective Services. Prior to this, she was the Bureau Chief for Family Assistance Policy at the Ohio Department of Job and Family Services, and she was responsible for developing and implementing policies and overseeing grants for public assistance. She started her career in southeastern Ohio with legal services representing low-income Ohioans in civil matters, and then joined the Ohio State Legal Services, known as the Ohio Poverty Law Center, as a statewide legal services advocate and expert on public assistance and workforce development programs. She also serves as a member of the City Council of Worthington, Ohio. She received her Bachelor's of Arts from Kent State and a Juris Doctorate from New York University School of Law. And I'd also ask you, if you have questions during this presentation, to put them in the chat, and we will address them later during the panel session at the end of the presentations. Thank you, Beth. Thank you for joining us today.
Well, thank you for having me. It's funny, you have an very old headshot of me. So I'm going to take liberty and show my slides, which start out with my updated, older, wiser self. I appreciate having the opportunity to speak today about what's in the state budget. As was stated, I've been doing this work for a long time. I've been working on state budgets since 1996 in one capacity or another, and I feel privileged to be able to work on advocacy on behalf of older Ohioans now, and I've been doing this particular work for 8 years. The organization I work with is the Ohio Association of Area Agencies on Aging, which is a nonprofit statewide network of agencies that provides services for older Ohioans, people with disabilities, and their families. Our association engages in national and statewide advocacy to address issues which have an impact on the aging and disability network and older Ohioans and people with disabilities. We provide services to members, including training, and we serve as a collective voice for Ohio's area agencies on aging. And just to kind of give you an overview of the Area Agency on Aging network, there are 12 area agencies on aging that serve the state. And we are part of a national network of over 600 on-the-ground organizations in each state that are mandated by the Federal Older Americans Act and charged with helping Americans thrive in our homes and communities as we age. The area agencies on aging are mostly nonprofit, locally driven organizations that have partnerships with public agencies to deliver services through over 4,100 contracts with local partners to deliver direct services such as meals, transportation, personal care, and home modifications, just to name a few. They're able to adjust to the needs of their region and to be incubators of new services and methods of service delivery. So let's talk about what it looks like in Ohio in terms of home and community-based services, because that's what we're focused on, is really enabling people to stay at home, to age in place at home and in their communities. This slide really demonstrates the efforts that we and others have made in the state to shift the service delivery from institutional care to home and community-based care. This is a slide from the Department of Medicaid that they shared during the budget process, which shows that prior to 2007, the majority of people, if you look at the orange line, that is the people who are living in long-term care facilities, and the blue line is the line of the percentage of people who are living in home and community-based settings and receiving long-term services and supports. And so, I mean, prior to 2007, those lines would have shifted, where the majority of people were living in long-term care facilities like nursing homes. And for many years, we've been working to move them into, to be able to serve people at home, because at home is where people want to be. It's most cost effective. And it's, I think really, in order to enable people to age well in their communities, that is the best way to stay connected and to have better aging outcomes. And so we continue to advocate to support those home and community-based services that are so important and that people need and want. And then this slide is from the Department of Aging in the state, which is a great infographic about the types of services and their costs and location. And so when we look at the things that we're most focused on in terms of advocacy, we're looking at this side of this picture, which are the home and community-based services that area agencies on aging are primarily responsible for. The local aging services are the services that are outside of the Medicaid system that an older adult may access through a local area agency on aging, a senior center, et cetera, that are funded with local dollars or state dollars or Older Americans Act dollars. And the average cost of care per month for those kind of services, the state has estimated at $66.99. So if you have some home delivered meals, that will enable you to remain in your home, in your community, for a very small price and a great benefit to individuals and the community. And then if you move to the Passport Medicaid waiver program, this is providing home and community-based services with some care management, but it's within the Medicaid programs for people who qualify for Medicaid. And it's also people who qualify for services under a level of care, that they need a nursing home level of care, but they're able to stay in their homes. And so it's significant to note that the cost for those services is about $1,225 a month on average. When you go to this side, you can see that the costs are considerably more. It's more institutional care, from assisted living to nursing home care. And these are primarily Medicaid funded programs. And so when we talk about home and community-based services, we're focused on those local aging services and the Medicaid waiver program in terms of state budget funding. And what we've seen is that in these systems, those services, home and community-based services, have really suffered from a lack of investment. It's been infrequent, it's been sporadic, and not across the systems. It's been piecemeal. And so our advocacy really this time in the budget was to bring attention to the whole system and the benefits to people and the benefits to the state. So I don't know how many people are aware of how the budget works, but it's actually a year-long process to pass a 2-year budget or a biennium budget. And the budget runs from July 1st to June 30th of the subsequent year. And the state budget has to balance. We don't have the ability to have a deficit in our budget. And that's what makes it challenging to advocate for increases in things, because there is a focus on getting that budget balanced. The budget starts a year in advance from the time it expires. And so this budget just passed at the end of June. That work started last July with the departments in the state making requests to the governor. And it's important to kind of know this process because how the budget has turned out is impacted by understanding the process. That the governor puts forth a budget proposal based on the budget request from the departments, and then that budget becomes the first thing you see in the General Assembly, the as introduced version of the budget. And that's the governor's proposed budget. Then the House has hearings and examines that budget and then puts forth a substitute budget with its own amendments and suggestions. And finally, after much deliberation, will pass that budget and hand it off to the Senate. So there's a House version of the budget. Then the Senate does the very same thing and passes a Senate version of the budget. And then it comes out in a conference committee where select members of the House and Senate come together to reconcile the two versions. Because most definitely the House version is going to be different than the Senate version. Once that's reconciled and new things could be added into the conference version of the budget, that is voted on by each House. And then that's the budget as passed. Goes to the governor. And then the governor has the option to sign the budget, not sign the budget, or do line item vetoes, which is unusual. It's different from the regular sort of bills you would see where you either veto or sign or not do anything with the bill. So the governor can strike out language from the budget bill. It's unique to an appropriations bill. Usually what happens if the governor vetoes something, he will have a message that goes with that veto to explain why. And after that, then the General Assembly can actually vote to override that veto. And so even if a budget passes June 30th, the work may not be done. Fortunately, this time we didn't have an override situation for our items, but we have in the past had that discussion and had to continue watching the budget well past July 1st. So as I said, we really were focused on for our work and the work of many organizations in the state, looking at across populations and programs, ensuring that home is a real option for older Ohioans and people with disabilities. And how do we shore up that system? We have a workforce shortage in our system in the state, and this is actually a national issue. For people who need primarily home care, whether it be medical, non-medical, we have a shortage of people that can go out and do that work. And so we actually have done surveys in this last budget cycle that demonstrated that while we've had people enrolled in the program, we have programs, either local programs or Medicaid program for home and community-based services, that we were seeing people who were going without care, up to almost 3,000 people at one point in our surveys in April. And so people are essentially on waiting lists to get services, which is real problematic, and it really jeopardizes our ability to keep that path of people staying at home and being able to stay at home. And also jeopardizes our state budget if we're not really focused on the things that matter, the things that really people want and will be beneficial to us. So I'm going to talk about what's in the budget real quick here, and focusing on aging and Medicaid and home and community-based services. But if you're interested in an overview of the final budget for some of the bigger picture items and things that most people were talking about, if you're really looking at a high level, an income tax cut, a broadband expansion program, and a school funding plan were hot items that were discussed and put forth in that budget. And you can go to Advocacy for Ohio's Future's website to find out more about what's in the budget for overall health and human services programs. Advocacy for Ohio's Future is a statewide coalition of health and human services advocates and organizations that come together to advocate for good public policy and investment in those programs. So let's start with the Department of Aging. We've had some great successes in this budget for older adults, and one of them has been increased state funding for the Senior Community Services Program. This is a state fund that is distributed primarily to the area agencies on aging to fund non-Medicaid services for people to be able to stay at home. And this would include home personal care, transportation, Meals on Wheels, home modifications, et cetera, outside of the Medicaid system. So the eligibility status is much broader, and the age range is 60 and older generally. And these are flexible dollars. So each area agency can use these dollars to support their community as they determine the need. And this is really important, that this $1 million that we were able to secure, this is something we've been advocating for a number of years, because this line item, these dollars also allow us to, they're considered like match dollars or maintenance of effort dollars that allow us to draw down federal Older Americans Act dollars. If we don't invest state dollars, we won't get federal dollars. This fund has seen a steady decrease in the several years since the early 2000s. And it's been problematic because we've not been able to meet the needs in our communities for these services. And with our demographics, we're lucky that people are able to live longer, and we have more people living longer, but they will likely need some bit of service to enable them to remain at home. And so that's been our advocacy on this issue. And we've really been able to, in the last several years, demonstrate where the needs are. And we're advocating that we would return to a level of $10 million, which was right around the recession here. As you can see, at that point is when there was a significant cut to this fund. And so in the end, there was also a cut during our last biennium budget as a result of the pandemic and trying to keep the state budget balanced while we were dealing with uncertain economic times. But we were able to get an increase almost to the point of what we were advocating for. So that means more meals, more transportation, more services that are going to be available to people in the community. And so then to move on to other things in the Department of Aging budget that I think are of interest, there is an at-home technology pilot program which provides grants for remote monitoring of health conditions for older adults in various settings. It's a great idea to testing out some of this stuff that I think has been important for testing out during the pandemic and the situation we were in. What's not in the state budget bill, I think is important to note, is that there was a significant line item that was introduced by the governor to fund, it's called statewide aging initiatives, that would fund implementation of a strategic action plan on aging. Unfortunately, that did not get funded. And so this Department of Aging is working now to identify ways to fund things that would support that strategic action plan on aging. And you can find that on the Department of Aging's website. Another thing that was put into the budget during the process and then eventually did not end up in the final budget is an expansion of the program of all-inclusive care for the elderly. There is one site in Ohio currently that is operating this PACE program. That language would have required the state to explore expansion into a number of other cities. The Department of Medicaid is the other area where we focus on the budget because that supports the home and community-based services under the passport waiver and our duals demonstration program. Our primary ask in this budget, and the thing that all entities, either nursing home, assisted living, our organization, home care association, all of us agreed that we needed to advocate for an increase for home care and assisted living for the providers. They get paid by Medicaid, but it's a really low rate. It hasn't kept up with the amount needed to serve the population. And so we're losing providers. And in tandem with that are low wages for the people who actually go do those services. Because there's low rates, there's low wages. And so you're competing with distribution centers and Amazon and fast food in order to recruit people for those services. So during this budget, we were able to secure a total of a 6% increase in that rate, which is going to help a little bit with that issue, but we certainly need to do more. And part of that increase was something the governor put in the as introduced version of the bill, and we were able to get an additional 2%. The tricky thing about this provision is that there's money in the bill. There was language indicating where this money should be spent. And the governor actually ended up line item vetoing the language, but the money is still in the bill. And the veto message said that the intent was the administration would implement these rate increases by rule. And that means it's not in state law. It's in a rule that is much easier to change if they need to as a result of economic circumstances or other things. They can increase rates or decrease rates through rule much easier than through legislative language. And so that process is currently underway right now. There are draft rules that are in place under public comment period to implement the increase. What the department has said is they're actually going to push all of that money into year one so that they see a bigger increase, and it would be implemented November 1st. So what this means is more money for providers, hopefully more money to get more workers so that we can fill that need, that over 3,000 people who are going without care. There was also money in the budget for adult day services, but how that is being distributed is still being determined. There is also had articulated an increase for home delivered meals. It's not in any language in the budget, but I thought it was important because that's also being discussed right now at the department as part of a change to, and all of these things are going to support home and community-based services in the Medicaid program. I know I'm really running up against time here, so I'm just going to real briefly go through the rest of these items in terms of what else is in the budget. Nursing homes had language reinforced. They actually have language in state law that requires increases, and they are up for reviewing that, how those increases are implemented through what's called rebasing, and that also allocates additional dollars for those rate increases. A note about this that I think is really important is that when they calculate the rate increases, staff funding is a priority for determining where to direct those funds, and they are not including any anticipated costs for capital improvements, building improvements. It's really focused on the need for staffing. Their quality incentive increases, creation of a quality incentive payment commission to discuss how that could be implemented in the future, and additional authority for the Department of Health to intervene when the health or safety of a facility resident is in jeopardy. There was proposed a bed buyback program that the governor thought had included in the as introduced version of the bill, but that was removed. That would have allowed the department to encourage nursing homes to right size, have more single room opportunities, as opposed, because of the pandemic and the risks of having more than one person in a room, and also because we have a 68% or up to 70% occupancy rate, which means there are beds that the Medicaid program are essentially supporting that are not being filled. And remember those lines where you see more people going into home and community-based care, yet we're still paying for nursing home care that is not being, that people don't necessarily want and that we don't really need to support. And then there was a whole bunch of stuff about Medicaid managed care reprocurement. It's not directly related to our discussion. And you can find a lot of information about that elsewhere, so I'm not going to cover that. Finally, the budget bill also included some really great things in terms of adult protective services, an additional increase of $1.5 million per year, which allows each county to get $65,000, which is essentially enough to support one caseworker per county. Some counties were in previous years getting much less. So this is a huge improvement. It's the most that's ever been available from state funds for adult protective services. ODJFS there's language in the bill to require the Department of Job and Family Services to apply for an elderly simplified application for SNAP, which means simplifying the process for applying for food assistance through the SNAP program, and also for recertification. And then there is a provision on home care licensure, which would expand the accountability and monitoring functions for home care
Beth,
for
you have
private
5
pay.
minutes.
Thank you. So that would require home care entities to go through a licensure process that doesn't exist now, whether they're private pay or under some other state program. And so, I think I won't go through the rest of this because I know we're running out of time, but I've hit the high notes, which are the supports for home and community-based services, which we think are very important. And I think the main focus of many of us in the state in terms of supporting older adults in our communities. So I'm going to just close here so we have time for questions and everything, but just to throw out that we do offer training for people outside of the Area Agency on Aging Network. There's an Aging in Ohio online course. It's an Aging in Ohio 101 about the network, about programs, about a lot of the things I just talked about. That's an online course that you're welcome to check out. And then we will be, hopefully, as we watch the pandemic situation, we're hoping to have an annual conference this year at the Hilton Easton in Columbus. So I know that was a lot. I talked really fast. I appreciate your time and hope that this has helped you understand a little bit about what we're working on here at the state level on the budget. And feel free to reach out to me if you have any questions.
Thank you, Beth. And I want to remind everyone that Beth will be with us during the panel session when we can address questions more specifically. One question has come up about the slide deck, and we will, after the webinar, we will be making that available on our website so that people can access it. Our next presenter is Robertblancato, or Bob. And he has an amazing history in terms of his involvement in policy around multiple topics, including aging. He's the president of the Blancato Associates. And in that capacity, he is a national coordinator of a bipartisan 3,000 member Elder Justice Coalition. He's the executive director of a National Association of Nutrition and Aging Service Programs and national coordinator of Defeat Malnutrition Today Coalition. He has long been recognized as a national advocate with policy expertise on behalf of older adults. In 2019, he was invited by both the Senate Finance and House Ways and Means Committee to testify on a range of issues. And that's a whole nother side conference, his experience with testimony before Congress. He has worked in the past for 17 years as a staffer in Congress and was appointed by President Clinton to be executive director of the 1995 White House Conference on Aging. And he is a member of the Senior Executive Service. As a volunteer, he serves on the National Board of AARP and the board of the National Hispanic Council on Aging. In 2019, he began a 4-year term on the National Advisory Committee on Rural Health and Human Services, and he was promoted by the HHS secretary. He holds a BA from Georgetown University and an MPA from the American University. He's also the recipient of numerous awards for advocacy, and most recently was named to the American Society on Aging's Hall of Fame. Bob, we're happy to have you with us, and I'll turn the floor over to you.
Thank you very much, Dr. Morris, for the nice introduction. And I want to thank Faye for the moving of the slides, which will be very important to this presentation. And let's go to the first one. And so I'm delighted to be part of this webinar series, and I'm sorry I'm not there in person. I love coming out your way. But I thought about it as I was getting ready, and I realized how Dr. Binstock was such a player in my development. I want to take a moment to pay tribute to him and his time at Case Western. I want to thank my friend Georgia Annisberger for suggesting me for this webinar. And I'm delighted to be on the program with Beth and Bill, and of course, my dear friend Samantha. And I noticed, looking at the participants, I see a number of friends from Ohio on there, not the least of which Bob Eckhart and Orion Bell from Benjamin Rose. So let's go to the next slide. This is about looking forward to policy affecting the lives of older Ohioans. And the topic is very timely, just considering two small things. One, the preliminary numbers that just came out from the census showing that we are a nation and people that are getting older. And then several months ago, we had the release of the profile of older Americans, which had some very interesting findings. Next slide. So if you look at by the numbers, those 65 and over total 54 million, or 16% of the population, with way more women than men. The stat I'm most amazed at is the percentage of older adults completing high school, 28% in 1970 up to 89% in 2020. In your home state, you've got more than 2 million people over the age of 65, a 27% increase between 2009 and 2019, and you rank 6th in the total of number of people 65 and over. Next slide. But the reality is there are many current and potentially future policy issues, federal policy issues that could affect the lives of older Ohioans. So let's talk about the overriding issue affecting persons of all ages, COVID-19, and the ongoing but hopefully not returning pandemic. Your case numbers are right there. You know them well, I'm sure. And, you know, we focus as a nation on the wonder of vaccines and how they were developed, but also we wonder about the unvaccinated people and their impact on this prolonging the pandemic. Next slide. I want to spend a minute on another issue that we need to focus on, particularly for older adults, dealing with pneumonia vaccines. You have 1 million cases of pneumonia every year with 50,000 deaths, mostly in the older population. There have been improved pneumonia vaccines approved by the Food and Drug Administration, but it takes this other advisory committee to give its recommendation for it to become available to older adults. And they're not scheduled to meet until October. And if that were to not change, that means that vaccine is not going to be available till well into the flu season. So we're doing some advocacy to push this group to meet earlier. And when you get to the resource page, we'll tell you how you can get involved if you want to help us push this thing over the finish line, so to speak. Now, next slide. So let's talk about COVID-19 funding increases. You know, we've had the pandemic forcing this Congress and 2 different presidents to take swift and dramatic action related to emergency funding. You look at those 4 bills that were passed in a year's time period, totaling about $6 trillion when you look at all the numbers. But when you look at the important programs for older adults, you can see how increases were provided for the Older Americans Act at $2.6 billion, the SNAP program, $30 billion, the Commodity Supplemental Food Program, Elder Justice, which I'll talk about a little bit later, and housing, very important in this pandemic period. Next slide. But also important, you know, were flexibilities and modifications that ensured that services would be facilitated. Let's start with telehealth, okay? You know, the Trump administration approved over 150 different forms of telehealth and telemedicine to be reimbursed by Medicare. And as I told my colleagues before we got on this webinar, I've got 3 updates to slides I wrote 3 days ago to show you how fast things move in Washington. Just yesterday, the Centers for Medicare and Medicaid Services announced that they will continue covering these Medicare telehealth services through the end of 2023. So a lot of these 150 that were covered temporarily will be extended by the administration. They've also announced yesterday an additional $19 million in telehealth grants going to address rural and underserved areas of our country. Then with the Older Americans Act, we have the flexibilities about allowing funds to be transferred unlimited between the different titles of the Older Americans Act. You know, for anybody who knows the nutrition program, it went through its biggest transformation in its history. It went from a program that served twice as many older adults in congregate settings to one that was serving 95% of their folks or more in home delivered settings. And the other change that was made was redefining a homebound person to include those who were socially distancing, which added a tremendous number of people being served by the Older Americans Act. Next slide. Now we also have in the SNAP program some very important flexibilities, including an increase in the benefits, the online purchasing of groceries, and the operations waivers, which make it easier to certify and enroll participants. Now, my second update is the fact that just a couple of days ago, the administration announced its decision to permanently increase the monthly benefit for individuals and families under the SNAP program by 25% above pre-pandemic levels effective in October. That's the biggest increase in the history of the program, okay? All driven to some degree by the growing need for this program because of the pandemic. Then we talk about Medicaid flexibilities. We see increasing the federal match rate for home and community-based services, which has allowed millions more to get various types of those services. And of course, expanded telehealth also in Medicaid. Next slide. Then we move to the most recent emergency funding bill, the American Rescue Plan, passed in March. And here again, you can see what was provided for older adults very specifically. Continued major increases in funding for the Older Americans Act, increasing the federal match under Medicaid, pension benefits for over 1 million union workers, $200 million for better infection control in nursing homes, and then of course, additional funding for elder justice as well. So these are all related to the bills that have already been passed by Congress to address the pandemic. So let's go to the next slide and talk about what's sort of in the wings going forward. You know, there are many bills that are pending right now that could affect folks in Ohio. The infrastructure and budget reconciliation bill being the two most prominent at the moment. Many of you saw the bipartisan infrastructure bill just passed the Senate. And your Senator Portman deserves a lot of credit for the fact that that bill passed. He spent a lot of time doing good bipartisan work in the Senate. The bill would include funding for roads and bridges and public transit, but also because of that, we should be thinking in terms of how this can assist in the development of age-friendly communities across the country. Because so much of the age-friendly is about infrastructure relief, okay, to make communities age-friendly. We also are seeing now for the first time, when you discuss infrastructure, that now includes broadband internet expansion, which is so critical. You can have all the telehealth in the world, but if you don't have access to broadband, what good is it? So we need to address that going forward. Next slide. Now, what will come next is the more complicated bill, the budget reconciliation bill. And, you know, there's been general outlines of funding that have been released. The bill started as a $6 trillion thing. Now it's down to $3.5 trillion. We don't know where we go from here. But the thing that a lot of us in the aging field are watching is what happens to the president's proposal for $400 billion in funding for Medicaid home and community-based services, okay, which has a lot of support, okay? But the question is, will that $400 billion number hold up, or will it get reduced as the process goes forward? In the budget reconciliation bill, you could see major changes to Medicare, such as lowering the age of eligibility to 60, the addition of vision, dental, and hearing benefits, as well as policies attempting to lower the prices of prescription drugs for beneficiaries. Many of you saw the president make his comments about specifically calling for Medicare to negotiate for drug prices in the future, to allow limited amount of drug importation, and something that we all support, the notion of out-of-pocket caps on spending for people in Medicare Part D. So these are things that are in the wings, and I don't have a crystal ball in front of me that allows me to tell you how it's going to play itself out. Just be assured that over the next few weeks, major decisions are going to be made. There's one going to be made on Monday in the House of Representatives when they're going to come back from their recess to take a vote on allowing all these different bills to proceed. So we'll have to see how that plays out. Next slide. Elder justice is certainly on deck, and I want to salute two colleagues who I mentioned already, Georgia Annisberger and Orion Bell, because we work together with the Elder Justice Coalition to get this important legislation moving forward. We have an Elder Justice Act that was passed and signed into law in 2010, but most good laws do need to be reauthorized and modernized. And this bill, these two bills introduced in the Senate and the House by two very powerful members of Congress, would in effect create for the first time a new elder justice infrastructure with $4 billion in funding for elder justice programs, leading with adult protective services, long-term care ombudsman, finally addressing in a meaningful way staffing, retention, and recruitment incentives in nursing homes, a new grant program to address social isolation, which is connected to elder abuse, and then legal services funding through medical legal partnerships and hotlines. These are important bills that are pending, that the indication is that both Chairman Neal and Chairman Wyden are going to try to put this bill in the budget reconciliation thing, and we're going to do our damnedest to make sure that happens. Next slide. We also have nursing home reform. Senator Wyden has introduced a separate bill to address many of the problems in nursing homes that were identified during the pandemic, such as requiring nursing homes to meet minimum staffing standards, having a registered nurse available 24 hours a day, a full-time, let's stress this point, a full-time infection control and prevention specialist, which is not common in many nursing homes, and to provide additional resources through Medicaid to support the care and staffing improvements and to raise wages. Next slide. Now, in the House next week, they are also going to attempt to add the voting rights bill to the bills they will consider in the near future. And this is a huge issue for not only older adults, but persons of color and Native Americans, is the threats that are out there now being passed by different states. Bans on ballot collection, out of precinct voting, which make it even harder for people to vote in this country. We have laws in Texas that we've been hearing a lot about that if go forward, set a very bad precedent for our ability to do the most important thing in a democracy, which is to vote. So the House is going to try to pass the For the People Act to end partisan gerrymandering and mandate automatic voter registration, 15 days of early voting, and no excuse mail-in voting. Okay, this will be watch next week, watch on Monday to see what the House ends up doing with this bill. But voting rights is front and center this year for sure. Next slide. So, as we think about the future, one thing we know, we're going to be resetting aging programs and services. That's one of the outcomes for sure. We can expect going forward a new and deeper focus on the social determinants of health. They have been revealed to be important and have factored into the pandemic. The concerns about social isolation are growing. We have more home and community-based services and more preventative services under Medicare in the future. We need to continue the culture of flexibility and service provision created that started with the pandemic. And technology will be a key in the reset of aging services and programs. But also, next slide, we've got to address the questions of equity. Okay, we know that racism and ageism have been exposed during the pandemic. We know about the disproportionate number of deaths that occurred in nursing home among residents. So the question is, what reforms are going to follow? From long-term care to real health equity in terms of access and quality of care. And a new study just came out that said that 1 in 3 seniors aging into Medicare over the next 10 years will be people of color, which shows you the rapid growth of the minority aging population in this country. And, DEI and the Aging Network, what is the role? We did a webinar, our NANS group did a webinar with Benjamin Rose Institute on that very topic. What's the role of the Aging Network in DEI? First thing we said, you have to confront it. Don't deny it. Examine all operational aspects of the work, from who's hired, who's promoted, and really important is, how is your outreach done? Okay, are you reaching the right people? Are you having the right people do the outreach? Also, we're also astounded at the lack of participation of people of color in boards in aging organizations and local organizations. Also, who are your funders? We need to establish more programs to let minorities in aging get the opportunity to grow in their field. This needs to be much more than a teachable moment. We need the full learning experience at all levels, from the personal to the community to the state and national. Next slide, which I think is my second to last. Yeah. So to say it's a busy time in Washington could be an understatement. It's still due in large measure to the pandemic. It's always been a two-pronged crisis. It's a health crisis and an economic crisis. Both are being addressed by the Congress and this administration. We have the expanded vaccines, and as we just learned this morning, the movement toward boosters now with a set date by which they will ask people to get the booster, and the booster will be made available for immunocompromised individuals and those like myself who are approaching the 8 months since they got their second vaccine. The American Rescue Plan, the infrastructure bill, they responded to the economic side of the pandemic. But the question really is going to be, how long is this pandemic going to be the dominant driver of policy? And we know, particularly those of you in local service provision, nobody had a playbook for this pandemic, okay? Just like we had no playbook when it started, nobody has a crystal ball on when it's actually going to end. And so for my last slide, I think it's safe to say that there are many lessons that have been learned from the pandemic that carry into the future. One of them is returning to the same old is not the answer. Innovations and new partnerships that have been created through necessity. Let's not forget that point. A lot of things were done through necessity. A lot of them should continue. We need to promote not just better outcomes, but but equitable outcomes in terms of health and services for older adults. We need to give a much higher priority at all levels to disaster preparedness, no matter what the origin or nature of the disaster. And in that context, we must give special attention to the unique needs of older adults in times of disasters. We should never take things for granted, and we must recognize the absolute importance of advocacy in enacting legislation and policy that positively affects the lives of older adults in Ohio and all older adults. And the next slide is a resource slide that I'll leave up as long as they want to for more information on some of the things I talked about. And as Dr. Morris said, our slides are available. And I thank you for the opportunity to be with you today.
Thank you, Bob. And you've given us a lot of information to digest. That is very informative and important to our work that we're all doing. And again, I would remind people that go ahead, and if you have some questions, enter them in the chat, and we'll be addressing those as we go through the panel session. And on a note with Bob talking about equity issues, dealing with equity is going to be the focus of our third webinar in October, which we have a slide later that'll give you the date. So we're going to move on to the panel. And I think we're moving in such a way that we'll have good time for questions and discussion. Our panel leaders today are Samantha Brooks, who many of you know, and she received her undergraduate degree from Elmhurst College in Illinois and a master's in social work from Washington University. And she has a postgraduate certificate in lifespan development and gerontology from Akron. She's a licensed social worker, but retired, though she's very busy in her retirement in the state of Ohio. She, as many of you know, have worked with her when she was with Benjamin Rose Institute, where she worked in multiple positions, from director of clinical operations, director of community advocacy, and commitments to policy, education about policy and advocacy for it. She strives to develop and strengthen relationships with public policy groups, legislative decision makers, and older adult organizations to communicate the impact of public policy and legislation on the daily lives of older persons. She is an active member of Senior Voice and played an integral role in the coalition's development and ongoing activities. Senior Voice is a nonpartisan group that includes local not-for-profit, state and county programs, retired labor groups, and congressional representatives. The coalition educates seniors and the public on issues of protecting Social Security. As she's been retiring, she's been an active volunteer for AARP, and I know locally is our go-to expert on Medicare and Medicaid and educating people. Our second panelist is also familiar to many of you, is William Tarter Jr., or Will, who's a fellow at the Center for Community Solutions and the liaison with Center for Community Solutions to the Council on Older Persons. Before being with Community Solutions, he worked in both state government and nonprofit organizations, including working with the Ohio Secretary of State Bruner on One Community and the Downtown Cleveland Alliance. He was selected for the Legislative Fellowship Program of the Legislative Commission of the Ohio General Assembly and appointed to serve on the inaugural Cuyahoga County Charter Review Commission. He's the founder and past president of Cleveland Young Professional State, a founding member of Engaging Cleveland, and currently serves on the executive committee of the Greater Cleveland NAACP. He holds a Bachelor of Science in Communications and a master's degree in public administration from Ohio. And Samantha and Will be leading our panel discussion. And I believe, Samantha, you're going to go first, so I'll hand it off to you.
You're muted, Samantha.
Don't mute Samantha, never mute her.
Okay, so I saw that. So I wanted to just thank Diane for the glowing introduction. It didn't need to be that long. I think a lot of people, participants do know me, and know that I do indeed work very hard to advocate on behalf of older adults in the state of Ohio and on a federal level. I am just so appreciative to have both Beth and Bob as presenters for our webinar today. I know both of them very well, and I so admire the knowledge and the work that they do on behalf of older adults in our state and a federal level. So thank you very much for your presentations. So I am actually going to provide a brief just overview and summary of what Bob said, inserting here and there some of my own opinions. And I have been forewarned that I only have a finite amount of time, and that I need to stick to my agenda. So having said that, Bob offered so much information for us this morning that we will be able to take that information and move forward, hopefully in a very positive way, to make sure that many of the policies and legislation that he has talked about is implemented. He enlightened us, started out by saying that Ohio has over 2 million persons in our state that's over the age of 65. And that is a 27% increase between 2009 and 2019. He noted that we rank 6th in the number of individuals in our state that are over the age of 65. I'm not surprised by these numbers, but I continue to be overwhelmed with the knowledge that we've known that these changes are coming for years, yet on a national and a state level, we lag behind in implementing policies and legislation to address our growing older population. And Ohio is on pace to become one of a handful of states, mostly in the Midwest and Northeast, that will have more residents age 60 and older than people under the age of 20. Among the places in this shift that this shift has been the most dynamic has been in Cuyahoga County, where the latest estimates from the Census Bureau saying that the change has already occurred in our county. So in a Cleveland.com article in May of 2016, using 2017 estimates and then projecting forward through the census of 2020, 64 of Ohio's 88 counties are on target for population of older groups to outnumber younger groups. So we are indeed, and the Department of Aging says that very clearly among others, that we are a growing state of older individuals. We should be doing more to address that. Given these statistics, one would expect Ohio to be working aggressively to maximize the well-being of its aging citizens. This is why this particular webinar, Policies Affecting the Lives of Older Adults, is important. Our interest in policies affecting older adults not only extends from the federal level to the state level, but we must also be cognizant of those policies that are being implemented on our counties and local levels as well, because the impact of the physical, mental health, social, economic security, and welfare of older adults is all going to come into play. I agree with Bob that the COVID pandemic and its variants have wreaked havoc on the world and has disproportionately affected minority populations and older population groups in our country. Bob cited the number of COVID cases, deaths, and impacts of the virus on adults 70 and older. But Bob, like you, new statistics have come have come into view since you noted yours, you might be interested to know that as of yesterday at 2 p.m., Ohio has now recorded 1,164,808 COVID cases with 20,640 deaths. You may be interested to know that 92% of these deaths have occurred with individuals 60 and older, and that those individuals who are 85 and older represent 50% of the deaths. We appreciate the additional funding and the increase to the FMAP supplied to states. We appreciate the support and diligence of the State Department of Aging and its distribution of dollars to support services, home delivered meals, personal protective equipment, testing, education, electronic devices, and telehealth, and also the support that they have provided to our nursing homes here in the state. But as Bob pointed out, the wings, reset, and roles are important. We know that life will exist after the pandemic, and long-term policies are needed to make sure that older adults in Ohio can continue to live as independently as possible in what Bob so noted, age-friendly communities. And that's something, for those of you that know of my AARP involvement, is a concept that AARP is very much involved with. And here in the state of Ohio, we actually have 14 communities or counties that are now age-friendly communities and counties in the state. And I'm proud to say, having been a resident or being a resident of Summit County is one of those age-friendly counties. But we are working towards making the state of Ohio an age-friendly state for older adults who reside here. We, appreciate and we want to support those initiatives around infrastructure. We know that we need adequate housing for older adults here. We know that older adults in Ohio have a higher level of food insufficiencies, and so we need to address that. We want safe environments. We want optimal physical and mental health services with accessible and affordable services and resources throughout the state. Achieving all of these things involves all of us. And I quote Bob here: we must recognize the absolute importance of advocacy in enacting legislation and policies that positively affect the lives of older Ohioans and all older adults. Your joining this webinar is a first step. Education is the root of all success. The next step is advocating, showing public support, educating policymakers and legislators, because we assume that they know those things that are needed for the population group that we are interested in. But many of them don't, and so it is incumbent upon us to provide that education. We want you to share your experiences and your knowledge. We want you to empower older adults and their caregivers to act on behalf of the populations that they are helping. And above all, we want you to stay informed. Finally, the greatest advocacy weapon that we have, like Bob said, is our vote. The democracy of this country depends on the ability of everyone to have an unencumbered process to voting. Adopting the goal of the Ohio Strategic Plan on Aging, or SAPA, as we know it, we should strive for all Ohioans to live longer, healthier lives with dignity and autonomy, and that disparities and inequalities among older Ohioans is eliminated. These are the things we want. These are the things that we have to work for if we are going to make Ohio work for its older population. So having said that, I'm going to pass the mic, so to speak, off to Will, that will give us a follow-up summary and some of his ideas about the state budget and policy and those things that Beth talked about. Will?
Thank you so much, Samantha, and good afternoon, everyone, for being here. Thank you so much to the Cellar Conference for having me. I don't know about you, but after listening to Samantha, I'm ready to run through a brick wall right now. That was really something else. And I'm not sure who made the decision to have me follow Samantha, but can we please make sure not to let that happen again, because that is such a tough act to follow. But her words are so true. I just found myself saying amen almost like the entire time. I'm going to just offer a few words to complement what you've already heard from Samantha. In Beth's presentation, you heard a lot about the things that were in the state budget. You also heard several things that were not in the state budget, or things that were in there and were then removed. Speaking as an employee at the Center for Community Solutions, we were very, very, very happy to see the restoration of funding for broadband, and not just the restoration of funding that was initially up to what Governor DeWine had put in there, but actually even more so, $250 million at the end of the state budget process. And we really want to salute all of the lawmakers who played a role in helping to make that happen. That is going to be an extraordinary opportunity for older adults across the state of Ohio. We were also very, very happy to see the increase in adult protective services from $4.2 million up to $5.7 million. And this follows another increase from adult protective services not too long ago. So we are going in the right direction in terms of adult protective services and making sure that there's support systems in place across the entire state of Ohio. Also, we were pleased to see the restoration in the $70 million in public transportation funding at the state level. Transportation is a vital component to social determinants of health, helping to reduce social isolation and also increase accessibility and economic development and community development. And the fact that Ohio got back to our $70 million public transportation figure is definitely worth celebrating. I'm very pleased to see transportation funding also in a lot of the federal pieces of legislation that we'll be seeing, and hope to see some great strides in the future when it comes to making sure that transportation accessibility is there for older adults across the state. I also want to just talk about a few things that we'll be keeping an eye on in the coming months. The first one is, as Samantha said, that there needs to be a sense of urgency about the need to support older adults. We talk about mental health, we talk about some of the social determinants of health. As advocates, we knew that these were issues before the pandemic. The pandemic did not necessarily reveal a whole lot to advocates. We knew that many of these issues were in place. However, they did create a sense of urgency when it came to what needed to be done in order to address them. And that's something that it is so unfortunate that the pandemic happened, but it also offered an opportunity to see what things could we put in place and what things could we keep in place prayerfully after this pandemic is over that would be beneficial to older adults. And so as advocates, what can we do to make sure that those things stay in place in the long term? We also saw that the pandemic increased a lot of issues related to social isolation. Again, we knew that social isolation was an issue beforehand, but then you talk about the closing of congregate settings and senior centers having to adapt, and that increases a whole new dynamic when it comes to the issue of social isolation, what we do to prevent that. Also, when it came to housing, I was so happy to see Beth include that part about what can we do to keep people in their home, because there absolutely is a fiscal savings there, but also quality of life issue as well, and making sure that people can stay in their homes. We'll be keeping a very close eye on the American Rescue Plan Act. The city of Cleveland received over $500 million in the American Rescue Plan Act funding. They recently just had their first hearing on how to disperse those dollars. Cuyahoga County received about $240 million. They received 120 so far this year, receive 120 next year. we'll be paying very close attention to how those dollars get used as well. And we're also going to be watching the county budget process in terms of how does the county respond to the health and service needs of the county. We're very happy to see issue 33, which is our health and services levy, pass last year, which will support a stronger health and service safety net across Cuyahoga County. We're also very happy to see things that at the federal level. Bob had mentioned the infrastructure bill and giving kudos to Senator Portman, and also Senator Brown also played a role in the American Rescue Plan Act with the pension fix that helped to support older adults as well. And so it was great to see our senators at the federal level actively involved in policies that would affect older adults. So shout out to both of them for all the work that they have done and continue to do. We also are watching this issue about racial equity. And I want to give a shout out to Dr. Victoria Winbush, who helped coordinate the Anna V. Brown conference a couple of years ago here locally. And what we learned talking to Black elders is they would share with us their experience, the disparate experience and treatment they had in a hospital setting, and some of the issues and concerns that exist to this day because of some of the disparate treatment that they received and the outcomes. Again, Bob had mentioned the disproportionate impact of the pandemic, and that is something that manifests itself in the Black community, and that's something that we also want to raise awareness about. And when we look at the events of the past year and a half, for Black elders, you saw a lot of racial unrest in the country, and we have talked with individuals who have expressed concern about the mental health of Black elders because there could be historical traumas that have manifested itself kind of in today's climate. And then you introduce the added level of the pandemic as well. And so just making sure that we recognize that this pandemic is affecting everyone, but is not affecting everyone the same, and recognizing that the response also needs to be adapted to the various ways that's impacting the community. So with that, I'll just say thank you to Beth and all the folks at O4A for everything that they have done and continue to do to advocate at the state level. I want to salute our Western Reserve Area Agency on Aging and the work that they do here locally. That's something that, again, when you're talking about how to make sure that the community and the community needs are met with all these programmings and funding that is coming into place, making sure that these agencies are nodes for information and connectivity is so very, very important. It's going to continue to be important moving forward. So thank you, Beth. Thank you, Bob, for both wonderful presentations. And I see we're already getting some questions, Dr. Morris. So I'm going to turn it over to you to help facilitate the Q&A.
Okay, thank you, Will. And I think we mislabeled this time period in the program. We should have called it the rallying point, not the panel, to thinking about the work ahead. We do have some questions. First, I want to note that Beth has shared with us in the chat the link to the Ohio Strategic Action Plan on Aging, and also that that's going to be a discussion in relation to equity and justice for webinar number 3 that will happen in October. There's several questions right now, and you can put them in the chat or the QA. We have one in the QA that's for Bob from Ms. Jackson. What are the specific examples that the Aging Network should consider to assume a role in DIE?
Well, thank you for the question. And, you know, some of what I said in my comments, I'll repeat because I think they're important. I think, first of all, you have to examine the entire operational aspect of your work. You know, you need to do a cultural assessment, frankly, of not only your own workplace, but the community that you're involved in. Your outreach becomes extremely important. You know, how do you go about finding, you know, we have in the Older Americans Act, Beth knows as well, there's a targeting requirement that you must serve the older adult in the greatest economic or social need, with particular attention to low income, minority, rural, limited English speaking, and so on. Well, you know, that is a reporting device. It's more about how do you get the people in who deserve that service to begin with. And that's what outreach is all about. And I think that's an underappreciated, important component to addressing the equity issue. And and I'm going to go back and say I've seen too many boards of area agencies and social, community service agencies that are very white. Okay, and they need to diversify there because they make decisions too. So those are some things that I would offer.
Okay. Thank you, Bob. I think that's really important. I see the same thing you do in boards, although I see some changing, but it's taken changing the membership of the board and getting continued squeaky wheel about we have to be more representative to make that happen, but we can make it happen. Another question I think anybody could take, and I actually would like to make a comment too, is from Dr. Ross Alamoki. Are nursing home lobbyists interfering in the increase of funding for home care and the maintenance of funding for unused nursing home beds? And I'd like to just make a comment because in full disclosure, I serve on 2 nonprofit nursing home boards in the Cleveland area. And what I see the boards themselves having to help them face the fact that the business is changing and how the economics and financial considerations are changing. And one of the issues for some very dedicated boards is who are really committed to their mission is helping them to see how that mission can still be met, but maybe through different methods than they've used in the past. I also see people struggling with, and this is again, experience with nonprofits, struggling with thinking about how do they transition the way of traditionally doing business and still remain viable to provide services? How do you move from nursing home care to community-based care in the housing where seniors are? How do you diversify the offerings you have? So there's some different aspects to that beyond lobbyists who may be, I'm not sure they're supporting that business be done the way it's always been done, but they certainly are still looking at their business and their profit, especially if they're for profit. The nonprofits are looking, how do we survive or not? So just my general comments, and I'd open it up to Beth or Bob or Samantha or Will, whoever would like to respond to that.
Well, I can start. I think that those are very good comments, and there is a distinction, I think, about nonprofit versus for-profit in terms of how advocacy is engaged in. And I think the other challenge is that for Medicaid, nursing homes, the access to nursing homes has been an entitlement. So it's a required part of the Medicaid program. A state must support that, whereas home and community-based services are still optional. A state could choose not to even offer them through the Medicaid program. And so it's almost like an afterthought that has been going on for a long time. And I think what has happened, particularly with the pandemic, is nursing homes have the problems that have arisen with nursing homes have been exposed in terms of workers and needing to provide care and thinking about infection control, all the things that Bob talked about. But it also really showed the benefits of home and community-based services. There are issues with regard to social isolation, but there are a tremendous amount of benefits. So I think that as you see from federal initiatives, there's really a renewed focus and looking at home and community-based services. I think there's a whole bunch of reasons why we haven't invested in home and community-based services. And I think that that's one major one. The other one I would say in terms of looking at how we support people as we age is ageism. And that we don't think about older adults as included as members of our community. And when you're thinking about equity and inclusion, thinking about ageism as well as one of those components. And policymakers. I'm working with the Reframing Aging Initiative to really help policymakers understand the challenges of aging in a way that they feel empowered to respond, and to help them understand what ageism is. And so I think that's also been something that we have been fighting in terms of how do we all, because we're all aging, how do we stay engaged, and how do we communicate the value of older adults in our society? So I think there's a lot of things. Those are my thoughts, and I'm happy to hear what other folks think.
Well, the question had sort of a state tone to it, I think, but let me try to put a perspective at the national level. One of the things that I'm most proud of in the Elder Justice Coalition is the fact that we have the nursing home industry and the nursing home residents' rights groups in the same coalition. Okay, and you look for the common ground. The common ground that may exist, and common ground has a lot to do with quality of care. And a commitment to understanding the importance of quality of care. That is why staffing became such an important component of that elder justice bill I mentioned before. That was universally agreed upon, but it isn't just, it's about adequate pay for staff too. Part of the reason why there's such a struggle is a pay issue. I mean, you have to confront the reality of it costs money to have staff, and they should be paid appropriately for the work that they do. I would also point out that I think that, we have achieved a certain degree of rebalancing in Medicaid, in the sense that there is more money spent on home and community-based care in Medicaid than there is on nursing home care for the first time in our history. However, it's not enough. And until it becomes required, as you point out, Beth, you're not going to see that influx of additional funding and responsibilities and options for people's care. That's why it's so important in this budget reconciliation bill to get that specific commitment of dollars for home and community-based care under Medicaid.
Thank you, Bob. Any other responses from the panelists to that question? Okay. The next question we have, one near and dear to my heart, from Dr. Delansky, what steps need to be taken to get more money to support PACE programs? And for everyone to know, the one PACE program in Ohio is the McGregor PACE program, and they are only allowed to serve the zip codes in Cuyahoga County right now.
So let me start by saying, I think probably a very first step is education, because many, I think, older adults, those of us in the community, and legislators, policymakers, really don't understand what PACE is, and realize that PACE, and we were talking about nursing homes. I absolutely believe that along the continuum of care, nursing homes have their place. But we have to, as we have greater numbers of of individuals coming into aging and needing the kinds of home and community-based services that they will need, and that will be all of us if we continue to live. We have to figure out a way that we can support the needs of those individuals. And PACE is a step between assisted living, when that no longer meets the needs of that individual, and a nursing home. I tend to call it a nursing home without walls because of the kinds of services that are provided there. But and it's a shared cost between the state and the federal government. So I think we cannot ignore those community services that promote healthy aging and independence for older adults, aside from profit, so to speak, of those in nursing homes that would rather see individuals come into their homes. They have their place, but I think nursing homes are going to have to come to grip with how can they continue to support the continuum of care for older adults, which includes PACE. So education, I think, is a first step, Mary, to getting Ohio to the place where we want to support that program, and we need to support that program.
Yeah, and and Samantha's absolutely right. All-inclusive care Okay, that's what PACE stands for, all-inclusive care. And, you know, we've got to approach the future on funding questions, and especially from a holistic standpoint when it comes to aging. Okay, you can't compartmentalize much further, because when you do, somebody gets left out, and somebody gets too much sometimes, which makes it wrong too. You know, you've got to look at the complete picture, the continuum, as you refer to it, all-inclusive, whatever the terminology may be. But when it comes to PACE, yeah, it is somewhat astounding to me over all these years, when there are so many good PACE programs running around in this country, how little people know about it. You know, it's one of the best kept secrets. I always say, like I use as an analogy, the Old Americans Act. It took a pandemic for the Old Americans Act to get the kind of respect that it deserves for the services it provides. Okay, PACE is not far behind. We got to look at the same thing. So yeah, educating. If you have knowledge about a successful PACE program, let it out. Let that word out to the legislators and let them know about it.
Yeah, and just to underscore the importance of education, in Ohio, looking at our General Assembly, we have term limits of 8 years. And what that means is that you have some individuals who are new to the General Assembly who might not be familiar with aging issues, period, but especially some of the specific programs that are involved in older adults. And so that education is constant when it comes to making sure that people who are in the General Assembly are familiar with your organization, are familiar with your issue, are familiar with the demographics, are familiar with the programs, and making sure that they are informed at every step of the way, and not just the budget process. And that's something we talk about in advocacy. It's a constant thing, not just during the budget process, and constant education with this influx of new legislators on a regular basis.
Right. And the advocacy issue has to then be part of the education and go hand in hand with it, and alongside of it. For the first time since the current PACE program has been in existence, it was this past spring, for the first time, actually 3 state legislators came physically to look at the program and to look at the sites and to look at who's being served there. And you know, so they don't even understand it well enough to know how they compare that to other programming in the state. As far as community-based program, you know, it's not, you have apples and oranges, you don't have apples and apples. And so they really need a lot of education, and even education about how they should look at the models and what kind of data they should look at. Let's see. This point is a comment, but I think might be worth discussing as well. I just rolled past it, so give me a minute to flow down the file here.
Hey, Dr. Morris, there was also a question in the Q&A. I want to make sure that.
Yeah, I'll get to that
okay.
one too. Yeah.
Okay, just make sure.
I already asked the one in Q&A. Okay.
Oh, okay.
I don't see a new one.
Oh, yeah, I apologize.
That's all right, no problem. I'm glad you're monitoring me, because I can get lost in chat or some other thing.
Apparently, me too.
Something that wasn't mentioned, Cindy Rossi is mentioning here, but I wonder what comments people might like to make. She's saying, I encourage every Ohioan to monitor the progress of the redistricting for the Ohio General Assembly and Congress. So I just wanted to open that up, and whether anyone wants to make a comment about that. So it's about redistricting and the implications of that in terms of policy and care.
Well, I think more broadly at Community Solutions, we've been watching the census process play out and making sure that older adults were counted during the census. And that this is the reason why. It's because you want to make sure that older adults are counted in these redistricting conversations. And Bob and Beth can both attest about the importance of making sure from a federal funding standpoint that those census takes are accurate. And we recently, saw the data get released from the census. Bob mentioned it in his presentation. And there's actually going to be processes underway, two processes at the state level, one to redistrict the state House and state Senate districts, but also the congressional districts. And if my memory serves me correctly, there's actually going to be a listening tour of state officials going across the state of Ohio to get input on the redistricting process. And if I find the link, I'll try and put that in the chat to share with everyone. I concur with Cindy to make sure that people do pay attention to the redistricting process, making sure that people are familiar who their legislator is, and if it changes going into next year. I think that there's been a lot of conversations about voter education moving forward, especially in light of a lot of the election-related legislation that has been introduced and is pending at the state level. And so I think that from a representative standpoint, it's going to be really, really important to watch that process. And also from a representation standpoint. We talk about communities and the role that they play in the advocacy process and making sure that the people's voices are heard. So I'll try and find a link to the listening tour. I would encourage people, if you can find a site near you, to please stop by and at least just listen to what is the information being presented on the process. But also, if you have thoughts or concerns or feedback, please do use that as an opportunity to share your thoughts.
And so we'll actually, that link was sent out by Cindy a couple of days ago. And for the information of those attendees now, there's going to be a hearing on August the 23rd from 9:30 to 12:30 at Cleveland State University Student Center. If you'd like to attend that, and in Summit County on August 27th from 9:30 to 12:30 at the University of Akron at 302 East Buchtel Avenue. So Cindy also gave us the link for the other hearings. There are going to be 10. And is that what you put in the link, Will?
Yeah, it's in the chat now.
Okay, okay, very good. Okay, because I was going to send this to Faye, but thanks for doing that, Will.
Well, we can do both, you know.
Yeah. Send it to Faye as well, because we can put it up on our webpage in case somebody thinks about needing it later or loses the link from the chat.
Well,
Okay.
I'll put it in the slide presentation so they can be able to view it towards the end of the slides.
Okay, that'd be
Okay,
good.
Faye is on its way. And thank you, Cindy.
Okay. Well, I don't see any other questions now, and we're getting close to the end of our time. So I want to thank Beth and Bob both for taking their busy time out of their busy schedules to be with us today and to share information with us. And also to Samantha and Will for managing our little rally panel and guiding questions and a summary of what's going on. In the slides that you see, the link is in chat as well as on the slide to access the evaluation form and CE. And I wanted to remind everyone that we will be having our next program, part 3, will be on October 21st from 12 to 1:30. Our focus in terms of older Ohioans is on equity and justice. So we'll be talking about the state strategic plan, elder justice, and we will be able to follow up on some things that were mentioned today, but really dig a little deeper into the equity and justice issues that we need to be thinking about. So I want to thank all our panel, all our speakers, Faye for technology support and other support. And I want to thank everyone who attended today for joining us and being part of the discussion. Have a good rest of the day.
Thank you.
Thank you so much.
And thank you,
Thank
Bob
you.
and Beth.
Yes, thank you.
Thanks
Thank
for
you,
having
Bob,
us.
Beth. Have a good day.
All right. Bye, everybody.
Bye-bye.